I'm Lisa Yen, Director of Programs and Outreach for the Neuroendocrine Cancer Foundation. I'm here in Miami, Florida with Dr. Udhay Grewal from Emory Winship Cancer Institute in Atlanta. And we're really excited to be together to talk about neuroendocrine. I know, Dr. Grewal, you've been a huge advocate and really passionate about bridging inequities in cancer care. And I've been following along your work and really deeply grateful for what you've done. Can you talk a little bit about that, please?
Absolutely. Thanks so much for having me here. It's wonderful to be here. I think the reason why I'm so passionate about inequities in neuroendocrine cancer care is because when you see these patients in clinic, they don't seem to be the same patient population that you find on clinical trials. And we also see firsthand a lot of the disparities, inequities, and barriers to standard of care therapies and care that these patients, representing racial and ethnic minorities or rural patient populations, and such that they have to deal with in the real world setting. So that really drives me to lead some of these efforts in bridging those gaps. I don't think we can bridge those gaps in a month or a year or 2 years. This is going to be a work in progress, but this is such important work because I truly feel that progress is not progress if it's not equitable, and if that progress is not made available to any and everyone who needs and deserves that progress. So I think as we are moving towards newer therapies and newer developments in this field, it's also important for us to focus on making sure that these therapies and newer developments are made available to all. We've done some work in this area. Last year, we had a presentation talking about racial and ethnic disparities in neuroendocrine tumor clinical trial enrollment, and the manuscript is in progress right now. We also looked at end-of-life care disparities in patients with neuroendocrine tumors, and we saw that Black patients were less likely to get palliative care support at the end of life, which I think speaks to the larger systemic inequities in our healthcare system and beyond. And moving forward, we're also leveraging some data from the NetPro study to highlight some of these inequities, and also simultaneously engage in discussions with advocacy groups, with professional organizations like NANETS and ASCO, to see what can we do to bridge these inequities and disparities, especially in this so-called rare cancer space like neuroendocrine tumors.
Yeah. Wow. Well, congratulations on your award in this area. I know NANAS recently recognized your work and presented you the Diversity, Equity, and Inclusion Award, the inaugural award, and it's so well deserved. Um, in closing, if patients or other people, caregivers, loved ones, want to do something to help move the field forward, to help you and others like you who are trying to bridge this gap and get to all patients so that progress is real progress, what could people do?
I think you're a great example of that, Lisa. You've really made things go around in this field, and you've really led from the forefront a lot of these efforts in making patients' voices heard and leading a lot of the advocacy efforts. I think um, patients and caregivers who feel strongly about advocacy and representation should not wait for the right opportunity. They should get in touch with folks like yourself and NCF, and their goal should not be like impacting 100 patients. If they can impact the life of another patient like themselves, I think that's a huge impact in itself. So I think we should not wait for the right opportunity. A lot of us want to hear them. A lot of us want to work with them, and they should reach out to us and hold hands and move towards equitable progress.
Wow. Yeah. No effort is too small. You never know where that'll lead. And together, again, we are making an impact. So thank you again for all you do. We're really grateful for you.
Thank you. The pleasure's all mine.